something that we fully support. We've seen their work in Colorado, rolling this out, and it had an enormous effect, and now we're so thrilled that it's going to be here in New York City. So without further ado, I want to introduce 32BJ President Manny Pastrich, who's done, as I said, such incredibly important work to fight back on skyrocketing hospital prices. Manny.
All right, thank you, Julie. And as you said, I'm Manny Pastrich. I'm the proud president of SEIU Local 32BJ. We represent 90,000 workers in the residential buildings, the people who clean and secure the office buildings here, airport workers, and school cleaners. And first, I do want to thank Councilmember Menon for inviting us to be part of this launch, and thank the council member for her leadership on helping to create the Office of Health Care Accountability. It's very rare that a piece of legislation gets unanimous support in the city, and Julie led that charge, and now we have the Office of Health Care Accountability. And that office has already borne fruit. Its first report came out, and it shows what we've been saying all along, what Julie has been saying, and what our partners have been saying, that healthcare, hospital prices are too high. The cost of healthcare has gone up and up and up, and it's hurting working people in New York. It's hurting 32BJ members. And the reason that the cost is going up is because of the cost of hospitals. If the cost of hospitals had gone up just the same amount as inflation, 32BJ members would have $5,000 more in their pockets. But the cost of hospitals has gone up 2 to 3 times the cost of inflation, and that's eaten into the wages of 32BJ members, so they have more trouble paying for their rent, paying for groceries. This has to change. So that's why we've taken on the fight to rein in out-of-control hospital prices, along with Councilmember Menon, along with the patient rights advocates, and Power to the Patient, and together we will change this system. This year, we received that first report, and that report says exactly what we thought it would. That the high cost of hospitals are 2-3 times what the government is paying for the same services, same doctors, same locations. 32BJ members, city members, all private insurers are paying 2 or 3 times the amount of what the federal government's paying for those services, and that's unsustainable. The city's employee health plan spent nearly $760 million at Northwell Health System, more than any other hospital system. And hospitals like Northwell's and New York Presbyterian and NYU continue to raise their prices at unsustainable levels. We can see it in the specifics. If you deliver a baby at Northwell's, you're going to average $32,000 to deliver that baby. It's $25,000 at Mount Sinai and $20,000 at New York City Health and Hospitals. What accounts for that difference? It's not quality, it's just prices that are too high. Price transparency is the foundation because it allows us to pinpoint where this excess cost is coming from and do something about it. But we can't stop there. Now that we've seen what hospital prices are, we have to take aggressive action to bring down those prices and make healthcare more affordable. That's why we're proud partners with Senator Liz Krueger and Assemblywoman Chantel Jackson to pass the Fair Pricing Act in this session in Albany. The Fair Pricing Act would set a price cap on routine services at the hospital's outpatients department, saving New Yorkers $1 billion. That's $1 billion that could go into the pockets of working New Yorkers. These kinds of fights would not be possible without the efforts of Councilmember Menon, the patient's rights advocate, and the hospital price transparency that they fought so hard to secure. So thank you. And next I would like to invite Ilaria Santicello, the Director of Research from the Patient Rights Advocates, to the podium to speak.
It's great to be here in New York City today. On behalf of the Patient Rights Advocate, I'd like to thank Councilmember Menon and 32BJ for pioneering price transparency for all New Yorkers. New York City is becoming a model for the nation. Councilmember Menon's legislation made it possible for New Yorkers to have clear access to hospital prices before receiving care. The next step is what brings us here together, our hospital price finder tool, so everyone can access those hospital prices up front. Patient Rights Advocate gathered all publicly available pricing data from